Again, I just am so inspired by this program called The Community Helping Our Indispensable Children Excel. I just think that's a beautiful concept. And I've got a chance to meet many of you, or at least hear your voices at our different meetings, like the operations team or the MDART team, and heard about the particular work that you're doing to connect with families and children during this very challenging time. And I'm quite inspired. So I think we're going to turn it over to Geraldine to give us an overview of the city's vision with this program as we launch into our second year together and working to serve our families. And I'll turn it over to Geraldine now to tell us specifically about kind of our vision for this program.
Good morning, or I guess I should say good afternoon, everybody. I feel like we kind of, like Holly was just saying, with really remembering and reminding ourselves what choice means. I feel like that is, it's a very impactful, it's kind of like a statement, you know, that we're choosing to invest and lead and work with the underserved youth. And I believe that the city is invested in funding programs benefiting our underserved youth and families. And I also believe that collectively we are all focusing on the youth, they're future leaders of our community, and we're doing our best to ensure that they have that support and the power to feel like leaders. And working together improves the quality of life of the youth and families, not just the youth. So when we're looking at this model and how important it is to serve families and youth, it's really part of the city's, and I believe the grantees, it's part of one of the biggest things that we do, and it's really meaningful. And I feel like we've really all worked well together on this and on the changes we were faced with through COVID and the numerous operations meetings we had weekly to see what the community needed and put the money out into the community directly. And I believe that the evaluation and results-based analysis really is going to help highlight the services provided and our collective investment in our youth. And so we will be providing more additional trainings on Apricot, furthering our collective knowledge of results-based analysis and what we can do to work together on it to make sure it's something that we all have the tools that we need to move forward.
Thank you, Geraldine. So I'll go ahead and share my screen if you guys don't mind. Look down here at our agenda. The first thing I thought I could start with is maybe show you the deliverable, what I'm trying to create to showcase the amazing work that each of you and your programs are doing in our community. So then you could think, well, that's where we're trying to get, and then we can take a step back and see what will it take to get there. So if you guys don't mind, I want to talk about our annual report that we're trying to develop. This is looking back at 2020. Yes, we're in April now, but we're going to be taking a look back at 2020. And then we're also building up to producing another report that will be more comprehensive that we'll release at the end of 2021, so by December. So together, we're going to be making sure we have the data and information that showcases how you've connected with families and the difference that you've made in their lives. Specifically, we've been gathering a bunch of count data, that's in the results-based accountability language, how much of a difference that we've made in the community. So that will be no trouble. Looking at what I've seen you turn in over the last year for your reports, there's a lot of great information about how much we've done. Another goal we have with the city is that we want to show that we are a place-based effort, meaning that we are a project that is funded by the citizens of Santa Rosa. They passed Measure O, which got the funding to the city, and the Violence Prevention Partnership, which was then given out to you as our community partners. And we want to show that this money that the city residents have invested has gone to very particular neighborhoods where the need is strong and where this investment can actually make a good and positive difference in families' lives. So we do need to do something to capture where you've been offering services. So we'll show you how we're kind of demonstrating that in the report, and we're going to take a look in Apricot today to see how we're collecting that information. And then we're moving towards this ability with a results-based accountability framework to be able to say not only how much did we do and where did we do it in our community, which places, but are we actually making a significant difference? And each of you have spent time with the Upstream team, our former members, people like Leah Murphy and Jay Carpin, who've moved on to other things, but had a great time working with you. And your new Upstream staff people that will be serving you, that's me, Holly White Wolf, and I've been terrible. I forgot to introduce my new coworker, Allison Carr, who's going to be supporting this effort. She can wave at you all. But our team will be moving you forward from the point where you've worked with Jake and Leah to identify these outcomes that you're trying to achieve, showing how we're better off. And we're working on building out Apricot to capture all of that information. So some of it is still in flow, but in general, for our report, we are aiming to show how much we did, where we did it, and did we make a difference in anyone's lives. If you guys don't mind, I wanted to show you our report. So I hope it's still showing on my screen here, but this is not a final version, and these are not the photos we're going to use. Part of my request for today is to say we need photos and great information to actually capture these moments of time that we've been able to connect with our youth and families. So here's some old photos, some placeholder text to give you an idea of where we're going. But we do plan to have a short report under 15 pages that we'd like to give to the community, where we set the stage and tell them about this incredible program that upholds all of our youth from a place of dignity and respect and leadership that Geraldine kind of talked about earlier, and highlights the good work that your programs do to help people feel supported and empowered and as if they can make choices that are positive in their lives. So we'll have some kind of fancy, beautiful report cover. Just ignore that page. We'll also have some type of letter from Jason and the Violence Prevention Partnership giving a context to this work. And then we will jump right in to talking about your programs. And so we'll have sections that talk about the different approaches that each of your agencies are taking. So for those of you, like I know we have 4 C's on the call here today, if you're supporting school readiness and parent education, we'll have a whole section in the report kind of dedicated to you and your program.
Start the evaluation measure. I think just Holly
I'm
White.
not sure if there's some folks that are not on mute right now, but we're getting a little bit of feedback from the audience there. If folks don't mind pressing mute just for a minute, we will open up the floor for questions in just a moment. And again, my name is Holly White Wolf. Sorry, my name was not showing up there on the screen. But here is just an example of what we're trying to showcase. So we'd like to ask you guys for your logos, the most updated ones. I was grabbing some offline, a great photo from you guys. And then from the Apricot system, we'll be pulling some information about the number of people that you've served. And if we've got some outcome data that looks good for this year, we'll share it at this time. If we don't worry, we will give a little more time for that kind of outcome data and showcase that in our next report that comes out in December. Just wanted to give people a little idea of how this might look. And the last thing as a preview is to look at our play space. So if you aren't familiar with this idea, for everyone in the system is tracking either events and marking off where those events are taking place within 9 different zones, or people are working with individuals and they are taking the intake information for those clients and families, and they're tracking zip codes and other information that will help us determine which zone those families are in. So these are the 9 zones that have been identified by the Violence Prevention Partnership as the key areas of our Santa Rosa community where we track our services and our interventions. And we'd like to be able to go back to the partnership and say, we've had a heavy concentration like we did a couple of years ago in zone 7. And a few years back, we identified zone 7 as being one of our high priority areas. And look, that's where we did our service. So this is kind of an answer back to the community to say, you made your investment, you know, we've worked as a community to identify where those investments should go. And look, you can now see we can give you a representation of where our services have taken place. So all of this is to say, all that data that you're entering into Apricot, it goes somewhere. It's really meaningful because if we are capturing the individual level data and we get those addresses in there, you'll see it'll go right into this map and help us populate and show exactly how many kids are kind of grouped together and getting served in a different neighborhood. And then again, like these kind of pages show, we're going to have some statistics very particular about the number of families or children that you're serving. And again, if we have it, we'll share some outcome data. So this will be our chance to showcase to the community your good work under these kind of pillar areas, is what we call them at the Violence Prevention Partnership, where we've said these are our areas of focus according to the strategic plan. we've made an investment in this area and we hope that we're making a difference. And very shortly, we will connect all of this to the results-based accountability framework, where we also connect all of these numbers and efforts to the indicators that show how the community well-being is measuring up. So we'll know how you're doing at the program level, and eventually we can say, well, are these programs making a difference to workforce development measures? Are we seeing people are getting more jobs? Are we seeing young people are finding more permanent employment after starting with our job training programs? Those types of questions can help us see if we're aiming to make a difference in some of these particular outcome areas that we're concerned about as a community. So any questions about this? Love to hear what you guys have to say about this idea of kind of how our information gets used and what your role might be in helping to populate a report like this.
Holly, I have a question.
Oh, please, Sandra.
So currently right now with, COVID, we've been doing a lot of presentations via Zoom and not really having access to as much information from the parents. So
Yes.
what I'm finding is that, we may have parents that reside in Santa Rosa, but there's no way to capture exactly where they live. So we've been writing in the data entry for Apricot, that they reside in Santa Rosa, but we don't have a way to capture what zip code unless they are having a conversation. We can have a general idea. How is that going to impact the current reports? Because I'm having a really hard time. There isn't like a program that captures zip codes even when people register. So we don't have, I don't feel like I have access to that. And when you have like 30 parents or 28 parents or 139 parents reviewing a presentation, do I really want to invest time whether getting all that data and contacting every single one of them, or do I invest that time providing the high quality services that we provide? So that's kind of the struggle that I'm having. And I don't know, unless we're out more in the community and have more access to the families, then I think it's gonna be really hard to capture that in current times.
Sure, and that's about what we want to talk about today is, how can we improve the data quality? Because you're right, Sandra, we've already kind of looked through the system and noted people are writing stuff in all kinds of strange fields because they're like, there's nothing that really fits right now. Like they're using the notes section to say, well, I served youth from these 10 schools, but they weren't the schools I intended to serve from. So the boxes aren't there to check right now.
Yeah.
But in general, if we can, the ideal would be, even if we have an online event, if there was any way to capture it with the registration, even to ask people when they give you their name, if they're registering, could they identify which neighborhood they live in? That'd be fantastic if there was a box to check. If that's not possible, if you're kind of putting the post out on Facebook and you just get who you get to the Zoom session, there is the section that I think you've been checking, Sandra, where it's just City of Santa Rosa resident, neighborhood unknown. And we might have a lot of that this year, and that will just be reflective of our truth. This with COVID time, and we got together virtually, and we were not able to track that by neighborhood because, as you said, that the investment needed to go elsewhere. But the ideal in the future, as we hopefully come back to a space of being in community with each other, we do hope to track this by neighborhood. But at minimum, if people could at least put the numbers in the unknown neighborhood section, that would be ideal.
Yes, because because I do a survey, try to capture that, but it's kind of, once the training happens, it's really hard for parents to get them engaged to turn those in. You might get little feedback like on your Facebook that you had I had a great training, but you don't want to sit there and ask them like, what part of Santa Rosa do you live in, So I think that is true. And I think once we start seeing our parents back in person or doing training in some way, shape, even if it's outside where we can, then that's something we can capture,
Yes.
This is Geraldine. I was thinking a Zoom survey, and it could be either at the beginning, in the middle, if you take a break in the middle, or I don't know how the end would do because people might need to get back to whatever they're doing, but that could be an option. But you're right, it is difficult during this time.
Yeah, I want to jump in and say that, Sandra, thanks so much for sharing that. And it's so important to share these sort of things, these barriers, so that as a group we can come up with ideas. Because I know that in it for experience with ROI issues and stuff, when you guys bring an issue and then one agency is doing something that really works, and then the other agencies can actually start to implement that. So one thing I've seen too is like doing, like Geraldine said, in the Zoom call, popping up a multiple choice question that says, what neighborhood do you live in? And then everybody completes the survey at the beginning of the training and you get the results via Zoom. So there's just, not saying that that has to happen, but there's lots of ideas, and working together as a group, we can all help each other because people have a lot of innovative ways to get the data. So I just get really excited about that teamwork piece. And thank you so much for sharing, Sandra, because these are the kind of feedback things that we like to hear.
And that's a really great idea, and I didn't even think of that. So this is really great to, why we're having these conversations, because that would have been like, you get up into what you're doing and you don't think of like, I need to get information how our training was, and then you're trying to figure out how to capture. So this is a good, if anything, I got great information today. That's something I can definitely put in place to capture some of the data.
And Julie, why don't you take us away and ask our next agenda item question here, because we're right on that subject. This is great.
Okay, so it's what could help us. Speaking of, sorry, I guess I jumped ahead, but you guys know I get passionate about this stuff. So what could help us improve the data quality and best showcase the choice grantee impact? So it's anything like what Sandra said right now. What barriers are you facing, or what ideas do you guys have? Once again, you guys are the experts, you're in the field. What is the missing piece here that will help us really capture everything you're doing, so that we can showcase it to the community, so that we can get Measure O funded again, so that we can keep up our programming, so you guys can roll it into your grant proposals. Let's just like work as a team, and we're really here to hear your feedback. So any ideas you guys have. Again, the question was, what could help us improve the data quality and best showcase the choice grantee impact? Any takers? Should I introduce the ROI web form, or? Okay, that might be helpful. So one thing I know, and if you guys have ideas, things come up for you as this meeting goes on, just feel free to jump in, put it in the chat. If you don't want to bring it up in this group, you could also email Geraldine or Holly or myself, maybe all three of us, bring the idea up. But one thing that I know that's been a big impact on the entire program model this whole time is that the ROI and the barriers to the ROI, and things got even more complicated once COVID took over our world, and we weren't even able to see people in person to get these signatures. And so it's been really the brainchild of Jeff and Holly and the whole team, that what can we do to help that? What can we do now in times of COVID? How do we get electronic signatures, and how can we improve the ROI process for all of you guys? Because I know it's a barrier on Apricot. And so this ROI web form was born, which I spoke about a little bit in MDART, but that was maybe a little bit early. And I'm not sure, Holly is.
Yeah, Jeff's on the call with us.
Okay.
And he can even walk us through it, I believe.
Yeah,
Jeff,
that would be the best,
because
because me trying to explain it verbally is not going to compare to you guys seeing what I'm talking about. So hi, Jeff. This is the genius behind Apricot. You guys, I've talked about you so much. So
great. Well, either that or the punching bag, one of the two. Hopefully we can get it working so everybody's happy with it for sure. Well, I appreciate you guys having me on the call today. What we want to walk through is a solution that we put in place to manage electronic consent. So the ability to get a consent signature from a participant and unlock the ability to track your program intakes in Apricot, which I know currently or historically has been primarily via some kind of printed document with a scanned signature. Can everybody see my screen okay? Thumbs up.
Looks great, yeah.
All right. So currently we have a solution in place. It's a web form. The link that's used for the web form can be shared with all of you. You can bookmark it. You can share it with your participants. What they need to do is they need to go to this link, fill out this form top to bottom. We have the option of either choosing English or Spanish. They'll fill in their name, sign it, enter their date of birth. And if a parent guardian signature is needed, that can be done as well. This form refreshes. So if you do have in-person events or things in which people are coming through your doors, you can use this form as a kiosk. So if you'd like multiple people to sign this in succession on the same computer, you certainly can do that. Once that form is submitted, it populates to a dashboard in your system in Apricot to process the release of information and create a participant profile. There is one problem with electronic consent in this format, and we resolve that with the next step that I'm going to show you. Having someone sign on a web form does not guarantee that the person who signed and typed their name is the person who actually typed their name and signed. So a web form is not validation of electronic consent. So you do have to complete a verification procedure, which I'm going to show you next. So the person's going to submit the form. In your dashboard, you're going to open the ROI. You as an internal staff member will need to confirm this ROI in a variety of ways. Either you need to confirm with the individual that they signed this ROI on this date, that this is truly them, that's their date of birth. And you can do that either with verbal confirmation of a virtual meeting. Maybe you witnessed them signing it during a Zoom call where they were sharing their screen, or some in-person meeting. If you select unauthorized, this process ends. But if you select that you receive verbal confirmation, you'll go ahead and type your name. Your email address. And you'll search for your participant that you've already created in the system. So let's say it's this person here. That action right there will unlock the ability to complete an intake and finish the process or get them engaged in your program normally in Apricot, which is very exciting because now we're not tied to a scanner, we're not tied to PDFs, we're not tied to verbal consent. We have a full documentation flow that identifies that this individual signed these consents, and I can now intake them into the program without any restrictions. So you can see here, the system is saying that we're good to go to complete our intake in the platform.
We do have a
Now, I
couple
just went through that in
questions.
about 3 minutes. The good news is that we do have a full user guide outlining how this process works, the links to all of the materials, and a walkthrough of how to complete the process. And that user guide is linked on your My Apricot home screen. There is a user guide button right here called View VPP ROI User Guide. That button will take you directly to the user guide where you can get started on this process. Why don't I stop there and see if there are any questions? Again, I went through that kind of quickly.
We do have a couple of questions in the chat, Jeff. And one of them was, I think the question was, can we do this on a cell phone? And I think you explained earlier, Jeff, that this is mobile friendly. The screen adjusts, to fit on a cell phone, and it is compatible. Can you confirm that?
Sure.
Nice, giving us a demo right there, getting as small as a cell phone.
So that's what it would look like on a phone with all the same conditions. That we saw earlier.
Okay, and another question we have is, this is a question from a particular agency, and they're saying that, they don't really work with clients. They have cohorts of young people that they're working with, so we're not tracking those young people as individuals. So is this form necessary? So I think with this form is, from my understanding, the city should really chime in on this, but the idea is that we are allowing for cross coordination with all of the partners and for open access to the case files of these young people. That's what the ROI is really stating. So if you are working with a leadership student in a capacity of a cohort, that's a different situation. We're not doing case management and case sharing for that youth. So I don't think it's necessary, but I'd love to hear what the city has to say.
Hi, it's Geraldine. I'm curious if the Center for Wellbeing has participated in any sharing of case management or help getting services, other services to the youth and families that they're working with.
Benny, feel free to chime in because you've been at those meetings more recently. But to my understanding, we're not offering up any case management examples from our students just because it hasn't been relevant. And I think that Benny still participates in those meetings, but they're not about our students. Is that correct, Benny?
Yeah, we don't give out any information from the members that work with us. Yeah, I think that's pretty much yeah.
I think it's best to have an offline conversation with Holly, myself, Julie, and the Center for Wellbeing team to see what we can work out. Ultimately, the more data we get on general things like age and maybe school they're going to, that doesn't identify necessarily with a name. I mean, as much information as we can get is going to be the best, especially now that we're all having to focus on the fact that we are going to not be funded pretty soon, and that we need to get this on the ballot, and we need to prove to the community why this is important and why they would want to support Measure O again. And so I feel like we can work something out that's really simple with Holly. And I was asking more about the case management. So that's clear now that there's not any case management solely focused on the leadership role. So thank you.
Okay, thanks.
Holly, do you want me to keep going through these questions?
Yes, I was going to say, can you see them or do you want me to read them to you?
No, I got the live stream here.
Okay, excellent.
So there's a couple of others here. Do we have to complete this for everyone? So any participant that you're going to track from it as an enrolled individual in a program, if that's one of your measures, this is required. And that's a condition of this.
It's a condition. By that, he means that we can't enter more information about that client in the system unless we start with having a release of information. So it's actually kind of like a required field, and you can't pass go unless we have this particular form. And we were starting with this today because we believe there's a lot that's not being currently tracked in the database because we were only able to use paper forms in the past. And we've been living in a digital world where those aren't very helpful. So we're hopeful this is going to open some doors to get more data in the system.
So we talked about the phone, mobile friendly. There's a question about, can we do similar options for the PYJ assessments So currently Apricot does offer the ability to send out assessments via web form. We don't have that solution enabled. There are some functionality not limitations, agreements that have to be made between the city, HSD, and each of the provider partners. So currently, the only things that we're surfacing as a web form or this type of entry is the ROI.
And can we go back a little bit to that ROI? I want to just clarify from, maybe I missed it, but like, what is the process of how are we getting that web form to the participant? So is this like a link we can send? Is it that they have to always just sort of going over the beginning process of we have a new client, we want them to sign the ROI. What are we doing? Because we all know how to log into Apricot, but how is that participant seeing that signature page?
Sure. So there's one link. Everybody will use the same link. So the same URL for everybody doing an ROI. The link can be shared any way you'd like. So we don't have Apricot configured to send the link because partly we wanted to remain flexible. So if you want to copy the link into a text message and send it, if you want to send an email to the individual, if you want to send the link over here, if you guys are excited, try it out. It's in the chat. So you can send the link any way you'd like to send it to the individual. The link is available currently in the user guide, and we can send this out to the team via email if you'd like to start using it right away. But also, again, it's right in that chat there.
Would it also help folks if we put the link right on your landing page in Apricot? Because if there was a little button that just took you right to that link, at least it would open up the tab and you can just cut and paste it and send it to your person if you're in Apricot actively. So that's another place we could put it if you need it.
This is Geraldine. I just wanted to let everybody know that we have put this proposal into the city attorney's office to see if they're willing to accept this kind of form and as a legal signature. So we are waiting to hear back from them. For this meeting on the city side, we wanted to get feedback to see what you think of the form. Is it something you would consider using? And if there's any other benefits or barriers you wanted to present.
Sounds like we're getting some requests though to go more digital wherever possible, like even the PYJ assessments. I mean, we might have really moved into a virtual world at this point that we're not going to be going back out of. So these are worthwhile things to explore. So any other ideas like that, please let us hear them.
Yeah, it looked like Sandra from Four Seas was interested, and I know that multiple options would be great, but definitely if you guys have other ideas for this, please shoot them forward. And like you were saying, Holly, even making this little, what is this called? Oh, a link, really accessible. So some that you guys could even put it in a text message, and then they could click on it and open it on their phone. Is that something that would be possible, Jeff? I don't see why not.
So currently we have it as just a link. So if you wanted to send a text message, have it on your phone, paste it into the text message and send it. We don't have the direct messaging feature set up on Apricot because of the broad group that we have here. So we're trying to keep it as nimble as possible. So currently it's kind of pick your poison with the link, send it any way that's convenient to you.
Yes, as long as because I just know that a lot of case managers use phones to connect with participants, especially these days. So I think text messaging it would be a good option. And not that Apricot needs to provide that service, but just as a way for it to sort of ease into the work they're already doing. So we're getting some good feedback here. Rocio and Annalise say that this would save them time, that they love this form. So this is really good because this helps us too, and we can say, you know, if we bring here when we hear back from the city attorney and be like, if this would really help our program, etc. So
I wanted to note too that we do recognize that perhaps the person that is making the apricot entries is not the person collecting the data. So there is, you know, a way we can work that out too with you, whether it's providing a form, basically what this is, and someone fills it out and then gives it to the data collection person. I know we all don't want to really rely on paper, but we're very invested in making it as easy as possible for our team here to get all the information we need.
Can I make a suggestion? If this is the first thing that parents are going to see, and I believe that logo is from the county, is that correct? Department of Health and Human Services?
It is, that's true, Sandra. We could
Could we
change that.
have the choice logo on here? Because it could be really confusing to a parent and they might feel like, you know, some parents will go to the county services and they don't want to apply for child support, or they don't want to do certain things or apply for programs. And that kind of is misleading, that they're not applying for county services and they're actually applying, you know, or getting services with our agencies. So just having the choice logo would actually be better for us. I don't want to create more problems than we need to.
Thank you for that feedback. I'm sure we can implement that.
all right. So any other follow-up questions specifically about this ROI? I'm not hearing any. Any other feedback about just ways that we can help capture this data or things that might help you guys? This was one thing that we're working on that we thought would be useful, but we're open to hearing more. You know, some people on the Apricot system are using the cohort data entry. And as Geraldine said, we're open to working one-on-one with you. And definitely plan on implementing more Apricot training and making this more visible during our meetings. So screen sharing Apricot, walking through the processes, showing you guys how this is done. I know we're all saying it, but we're really invested in getting this data online. So whatever we can do to help your agencies get there, just please don't be afraid like, oh, I don't want to, you know, ask that question or something. Ask any question, no question, even if it's like, I've never logged in, that's okay. We want to get you there and we're invested, and it's just about how do we get working and using this system, because as Holly said, like, there's a lot that this can do for us and for everyone if we get more data on the system. So again, all of that was to say we're really here to solicit your feedback as well. If you guys have ideas of ways that we can help improve the system, offering more trainings, one-on-ones, etc.
Julie, Serene actually had a really good question that I'm wondering if maybe Jeff can walk us through. And Jeff, you might have to like change yourself to being Serene to do this, but she's talking about the list of her caseload and her new referrals, and just saying that sometimes there are referrals on there that are out of date and they need to be cleared. So is there any way we could take a look at somebody's list and talk about what it takes to clear the list?
Sure. So we've made some changes to the referral assignments to allow users to clear their referrals. It was intentional not to let you clear referrals for a little while, so apologies for clogging things up if that's what it felt like. If you open up a referral assignment when it's provided to you, you have a number of options to clear it either positively or negatively, depending on what the outcome is. So we've changed the enroll participant screen to include 4 separate options for clearing this referral. You can identify that the individual did not enroll in your program, so the person referred did not enroll. You can identify that the family member enrolled, So someone else in the family enrolled. This person here did not enroll, but another family member did. You can identify that the participant did in fact enroll, and at which point you can proceed to complete an intake form. Or if none of the above occurred, they enrolled, but you just need to remove them from the queue. You can also do the same thing by selecting participant enrolled and you'd like to remove them from the queue. So again, kind of a quick hit demo here. All the definitions are listed here. In clearing your dashboard, we'd like you to go step by step through each referral by clicking the link, opening the page, and then selecting the option that's relevant to that person. So if fake participant took an action with you, we'd like you to tell us what action they took, and that will clear them from your dashboard. So those of you that have referrals from 2018, 2020, years past, you should now have the ability to clear them from that dashboard. And what we'd like to see is either zeros or so much referral volume from the city and from other partners that we're working to keep up with that list.
This
So I
is Celine
believe-
from SOY. Thank you, Jeffrey. That's awesome. I didn't realize it was there. I'm sorry, I didn't mean to interrupt. I just wanted to go back to that question about the ROI, and I think Sandra brought it up too, is that creates the duplication. So if we say, well, they already got enrolled, they're already enrolled and they have an ROI. And if you go back to that screen where you put they've enrolled, it prompts you to do an ROI. So if you put participant that was referred was enrolled and it prompts you an ROI, if they already have one in the system, that's what creates duplicate entries, or that's what used to create duplicate entries. So what would we do in that case?
Well, if the participant has an ROI, there shouldn't be a hold on this intake form here.
Okay.
I think what we've identified is that the issue that you're running into is that when you confirm, so let me come back here. So what we've been noticing is that in some instances, all of the organizations that are doing participant level intakes are not, are not enrolling the participant from this screen. So there's another way to enroll a participant, not from a referral. So if someone walked through your door and was not a referral from the city, you could just start an intake form directly, which is what many of you are doing. You're seeing the referral and then you're going to enroll them. No issue with that. That's why we've added this option here, participant enrolled, but we'd like to remove them from the queue. Our preference is for you to enroll them from this screen. So participant enrolled and then create an intake. But if that's going to duplicate an intake, we don't want you to do that. We want you to just remove them from the queue directly. So that's what these two definitions are for. Because we recognize that not everyone is enrolling individuals from the referral. They're doing it directly without going through the referral itself. So that's what these two options are for here. So that should eliminate the duplicate intake problem. So there's another question here. Once the participant client completes the ROI, will it self-populate to the intake form? Currently, no, you have to process the ROI. This is what's being reviewed at the city currently. The reason is that we cannot, or we don't believe that we can trust the submission of an ROI without staff verification. Because someone, like you saw earlier, I inputted Sally fake. There's nothing stopping someone from writing their name incorrectly or someone else's name on behalf of someone else and you not knowing. So we do require staff to have hands on this process and process this ROI. But we do believe that it will be faster than PDF, but that's what's ultimately being reviewed. So there's
And I
another
think
question. Can you send a referral from one agency to another inside of Apricot? If they are a choice or GPS grantee, yes, you can send a referral to another agency. And the way that that's done is from the participants document folder, you can create a new referral assignment record. Select which agency you'd like to refer it to. Save the record, and they'll receive an email notifying that they've received a new referral to then subsequently enroll them. I'm not sure that that feature has ever been used, but it has been available for about a year. So if you guys want to take a crack at that, high five.
We would absolutely love that. I mean, so you guys know what we do in MDART, the magic that happens there. That is something that's so hard to demonstrate to the community, to show the community, and it really is what wraparound is. If we were able to get you guys to use the referral to each other form on Apricot, we would be able to capture that and show, hey, look how many services this one person received and how many times they went around. The reason we haven't really pushed it is because we found that what we call the warm handoff in MDART really works so well, and we didn't want to create a barrier to services. So it wasn't a requirement to, if 4Cs wants to hand off to SAY, and I make this form right in the middle of you guys, right? We don't want to create the barrier to services, but exactly what Serene said, making that referral on Apricot would additionally let us capture it and be able to demonstrate interagency collaboration, the beauty of choice, the beauty of all of you guys working together, which is really, really unique and really powerful. So if we can get to this point of using that, referring to each other, that would be like next level. So I just had to jump in there because that's like a dream of mine. And just to let you guys know, because you're already doing this, right? And it is really what makes sort of the program so successful. So getting to that level would be really great. Okay, sorry, I didn't mean to like steam train the meeting there.
That's perfect, Julie.
Okay, so there was another question up there that said, I didn't want to miss it. So the interagency referral, but Sandra had said, once parent client completes ROI, will it self-populate the intake form so we don't have to re-enter data that is entered in one place? And can you add the phone number also on the ROI? So Jeff, did you kind of answer that question already?
Partly, we can add the phone number if you'd like. So we were using name and date of birth as an identifying combination of fields. If we want to make the decision to remove either remove the date of birth or add phone number, that doesn't have much impact on the overall functionality. And I would also say that in terms of double entry, we're not adding any new entry for the staff except for verifying that the ROI was sent from the individual that in fact signed it. So your entire process of going through the participant profile and the intake form, those are unchanged, and we're not adding any new data entry to your workflow. We're just giving you an alternative way to attach a release of information to the participant.
No, and my suggestion was more if it did populate, then if those are fields that we would re-enter. So if the parent would enter it, then it would, if it's self-populated, then it's one less thing to enter it. And then that's a way to capture if they changed their number from the time we spoke to them to the time that they completed the ROI. But if it's not self-populating, then we would enter it.
Right. I still think it's important to, I don't want to recommend using the release of information form as a way to complete the participant profile. Although we can provide virtual intake solutions for participants to fill out, we're hoping to take some baby steps and determine if this form is actually used. So we're going to do some monitoring to see if we should open up more capability. But I've written down the phone number component as a way to capture that information at this moment.
I think what these are really great conversations, because we are seeing that in the new virtual world, we have the technology and a capability to present forms and things like that to clients, like you're saying, Sandra, where they could just fill it out for us and then it would be right there in their file and we wouldn't have to ask them again during intake these same questions. That is technologically possible. We haven't designed the system that way right now, and it would take like some cost to redesign the system and make those forms available. And we do just need to make sure the cost would be worth it, since we're already in month 4 and we're contracted to do this for just a few more months. But we are, as a county, just so you know, this system is used by Human Services and by all of Sonoma County, and we have hundreds of participants and families and programs. We have about 23 programs. Like Choice is one program. We have 22 other programs like that currently in the system, and we're growing. We're actually adding quite a bit. So we are looking to learn from what you're saying now so that we can improve the system for the future. So if we don't do it in the next 4 months, we are going to be doing it in the next year or so. So I do appreciate your feedback, Sandra, and I want to make sure you know we're listening. We just have to figure out price-wise and timing-wise, when do we introduce all these things? Thank you.
Okay, I think that's about it for that agenda item, right, Holly? I guess the one thing I would just want to drive home to everybody, or as a team, is that we know that everybody has different programs and are entering different data sets. So some people have more individual level data, some people have more cohorts, and some people have more events. But as an entire Choice grant cohort, I guess you could call it, we really want everyone to be entering more data. So we're speaking to all of you in that piece, and we will work one-on-one with you, but we need, in order to be successful in year 2, we need to all be entering more data. And we understand about COVID and the pandemic, but year 2, the goal is to get more data in the system from every agency.
And it helps with our funding. Like, as an example, probation just asked us, can we do a big export so they can see how their dollars have paid off? So thank you very much for your efforts, because it is about serving the families, but then it also gives us a chance to demonstrate to our funders that what we do works, and then we can get more support to continue these efforts in the future. And I think that's pretty much, let's see, there might be one more comment there. But we were going to just say we'd like to meet again in the future to talk about the outcomes portion of the database. That's something that's still a little bit under development. Some of you are tracking outcomes actively, and that's wonderful. The system wasn't fully built out to track all of the outcomes that people are capturing, so we need to do some changes there. So maybe Jeff could give us a tiny preview of what's to come, and we'll get back together maybe in a month or so to show you the new tools we'll have for tracking those outcomes.
Pitching it back, Holly.
Just if you had anything further
Yeah,
to say.
sure. So there are a number of measures that are not participant related and potentially, or are de-identified aggregate measures. Some of you don't provide or log in the system direct participant activities, and therefore we need to do a better job of capturing how many people were served, how many people got across a certain achievement marker, how many people saw progress in a particular program area. We're developing a solution that will allow you to input your aggregate measures into Apricot instead of kind of sending them via email or Excel or other formats. And we'll be requesting those, I believe it's quarterly, is that correct, Ollie?
Mm-hmm.
And we'll be able to use those as key performance indicators to track trends over time. So for instance, if you are just serving kids and not identified in Apricot as individual participants, you'll enter, we served 10 in Q1, and then you'll enter, we served 12 in Q2, and then 10 in Q3, and so on and so forth. So that process or that procedure is in place. It's actually leveraging some concepts that we have deployed in other aspects of HSD around RBA, which is results-based accountability. So we expect that you're going to be able to enter all of your measures, even the ones that you don't, many of you have identified are not captured in Apricot. We're going to be able to close the loop on all of those measures. We're expecting to have that by the end of April.
And the point of all of this is so then we can bring the data back to you and say, look, we were really trying to make a difference in the areas of school connections or workforce development. And here is the data that you've collected. We'll present it back to you. You can say, yeah, that looks right. That's what the difference I thought I was making. You can see the other partners in your category. Like if there are a few people working on school connectedness, you can see how they're doing. And we can start to have these conversations we call the turn the curve, where we say, if we think there's a lack of school connection in our community, are our efforts making a difference, and what more can we do? So this isn't just about data entry, it's about using the data to understand our community better and see how we might shift what we do to make a bigger difference. So suddenly the data is going to get more meaningful. We promise you that. So thank you for sticking with us and giving us an hour today to talk about some of this. And we hope to have some new improvements in the system to you real soon. Thank you, everybody.